It is now true that COVID is present in our communities, in Germany, Italy, and in fact, all the nations around us and places where we have garrisons. You should seek care if you develop a fever, shortness of breath, cough, or other flu-like symptoms. Medical professionals use a number of criteria to determine a person's risk for having COVID. If they have a certain number of these criteria, they're considered to be at higher risk, and those people would be important to test. Also, it is possible in cases where COVID is really very common in the community to simply make a clinical diagnosis, which can be done without testing. We do it with influenza and other diseases all the time. Contact tracing is what we do to identify people who are most at risk for developing COVID. So when we identify a case, we look at who they had close contact with, since those people are most likely to develop COVID. We then ask them to quarantine themselves to maintain as much social distance as possible between themselves and others, staying at home. People who are exposed to a close contact are at no greater risk than the general population. People don't really transmit COVID very well until they develop symptoms, so an asymptomatic contact is not likely to be transmitting the illness, even if they develop it later. Now is the time that we need to initiate aggressive social distancing measures. You've seen a number of these already in the communities. The closure of seating areas in food courts and various other places where people can gather. We need to ensure that we maintain 6 feet separation between ourselves and others. We need to make sure we cover our coughs. We need to make sure we wash our hands frequently. And most important, we need to make sure that we stay home if we are sick and not expose other people, and to abide by all social distancing measures recommended by public health authorities. Please, this is really the time we need to come together to protect ourselves and especially to protect the community. A lot of disinformation out there. This can be either maliciously spread or by well-meaning people who just do not have the most accurate, up-to-date information. I encourage everybody, if they have questions, to go to the CDC website, www.cdc.gov, for the most current, accurate, and up-to-date information available. One of the populations we need to pay special attention to are our children, not because they get particularly sick, but because they tend to be very good spreaders of viruses. This is why schools may be closed in your area. It's important that you not respond to school closures by having large playdates or having the kids get together in another venue. It defeats the purpose of keeping children separated from one another. We also need to remember that this kind of social distancing can be particularly hard on children. It's difficult for them maybe to understand why they can't play with their friends the way they used to. And this can cause a certain amount of anxiety, I'm sure. It is important that you sit down with your children and talk to them about the reasons that these measures are being taken. This would be the best way to help reduce their anxiety, to make sure they understand that what we are doing is protecting them, protecting you, their family members, protecting their friends, and protecting the community as a whole.